Hello and welcome to this video. I'm going to take you through the topic asthma. Okay, so this medical condition is what we're going to look at. So, um, asthma is a chronic inflammatory disorder of the airway that is characterized by bronchial constriction response to a wide variety of stimuli, accompanied by wheezing, chest pain, dyspnea, and mucosal edema. Okay, now let's take a look at the types of asthma. So we have two main types of asthma. We have the intrinsic asthma and the extrinsic asthma. Intrinsic asthma, this is a type of asthma which occurs due to unknown causes and usually begins in adulthood, and it usually runs in families. Then extrinsic asthma, this is a type of asthma which is due to inherited abnormal reactions to allergens. So allergens can be inhaled, such as dandruff or pollen and other uh, inhaled allergens that you can think of. So two types of asthma, intrinsic and extrinsic. Intrinsic, the cause is not known. Extrinsic, the cause is known. Okay, now let's look at the predisposing factors of asthma. So one of the predisposing factors is allergy or antigen body reaction to certain environmental substances, which includes pollen, plant spores, the molds, um, animal airs, house dust, mites, and certain foodstuffs. Then the other predisposing factor is infection. So infection, especially upper respiratory tract infections like parainfluenza or heavy common cold, also mycoplasmal pneumonia, which will often onset an attack. The third predisposing factor is unknown factors, which seem to be intrinsic but cannot be explained. The fourth predisposing factor is emotional factors. So emotion is a predisposing factor where you have anxiety, anger, frustrations, and fear, which can provoke an asthmatic attack, including events such as an interview. Another predisposing factor is physical factors. So physical factors related to change of weather such as humidity, cold weather, temperature, and also barometric pressure. We also have irritants as predisposing factors. So irritants like dust, chemicals such as tetrazine or air pollutants. These can also fall under the predisposing factors. And the last type of predisposing factor that we can look at is genetics. Okay, so some genes are passed from parents to children. This occurs in more than one member of the family, such as the mother having a food allergen, hence causing the spasms and swelling of the smaller bronchi. Okay, so these are some, just a few of the predisposing factors to asthma. Okay, let's take a look at the clinical features of asthma. So, one of the clinical features of asthma is chest tightness and shortness of breath. So, this is due to exposure to an allergen or irritant such as dust, smoke, and others, which can cause inflammation of the airways. The other clinical feature is wheezing. So wheezing is reviewed on auscultation of breath sounds, especially during expiration. The other clinical feature is nasopharynx. Okay, pests, lip breathing, and also use of accessory muscles due to marked respiratory effort. Cyanosis is also another clinical feature. So cyanosis is usually due to impaired breathing. Coughing is also among the clinical features. So coughing, it shows up in an attempt to clear the airway because of the bronchial spasms. We also have chest pains as one of the clinical features, which is usually due to the inflammatory reaction. So these are some of the main clinical features of asthma. Okay, let's take a look at the pathophysiology of asthma. So when an individual inhales allergens such as pollen, anmodenda, or ingests allergens, hypersensitivity reactions occurs. Cells that play a role in inflammation in asthma are mast cells, eosinophils, neutrophils, and lymphocytes. Immunoglobulin E, also known as the IgE, have the ability to attach to the surface of the mast cells. When antigen such as a pollen reaches the mast cells, the immunoglobulin and the antigen form complexes known as the antigen antibody, resulting in the release of some mediators. These chemicals include histamine, bradykinin, prostaglandins, and the leukotrienes, which causes the inflammatory response, causing increased blood flow, vasodilation, fluid leak from the vasculature, which is due to the capillary permeability. Also, there is attraction of white blood cells to the area, bronchial smooth muscle constriction, and excessive secretion of thick mucus. This causes narrowing of the bronchi. Therefore, dyspnea is observed. Okay, so diagnosis and investigations. So history is the first thing that we do. So we're going to look at the history of the signs and symptoms of dyspnea and also history of allergies and familiar tendency. We're also going to do physical examination, which is going to help us to detect wheezing during breathing, and cyanosis, which is going to help us to indicate if there is hypoxemia. Chest X-ray is going to be done to rule out other lung diseases. A full blood count is also done to detect raised basophils and eosinophils. Then a sputum test for culture and sensitivity will review eosinophilia. Now, during acute episodes, sputum and blood tests may disclose eosinophilia. Now, eosinophilia is simply elevated levels of eosinophils in the blood. So there could also be increased serum levels of immunoglobulin E, as well as reduced oxygen partial pressures and increased carbon dioxide partial pressures. Now, when you're looking for the reduced oxygen partial pressures and the increased carbon dioxide um, partial pressures, we do the arterial blood gases. Okay, so this is how we do the diagnosis and the investigation of asthma. Okay, so let's take a look at the treatment for asthma. So when it comes to treatment of asthma, we have salbutamol, which we give 4 milligrams 3 times daily. So this drug, make sure that you do not give it to patients who have cardiac disorders. Then aminophylline is another drug that is given to patients with asthma. So we give 250 milligrams intravenously, slowly, over 20 minutes. So this drug, it relaxes the bronchial smooth muscles and improves the contractility of the diaphragm. The side effects include tachycardia and muscle twitching. The other drug that is given is prednisolone, which we give 5 milligrams once daily. Then we also give um, dextrose 50% to prevent hypoglycemia. Okay, so now let's look at the nursing care. So when it comes to the nursing care, the aims that we have is one of the first aims is we want to relieve dizziness. Then we also want to improve the tissue perfusion as well as to prevent any complications that might arise. So when you are looking at the nursing care, specifically the nursing environment where you're going to put the patient, make sure that you nurse the patient in a clean and well ventilated environment to prevent infection which can irritate the bronchi and worsen the condition. So the environment should be well dusted to prevent worsening the condition, since dust can predispose or worsen an attack. The environment should be free from strong smells to prevent worsening the condition, and also make sure that the resuscitative equipment should be within reach, that is the oxygen cylinder in case the patient needs oxygen. And then make sure that you nurse the patient in a warm environment to promote recovery. Okay, to promote recovery, because cold environment may precipitate or worsen an attack. And make sure that you nurse the patient close to the nurse's table for easy observations. Apart from the nursing environment, one of the things that you also need to take into consideration is the position and ventilation of the patient. So you need to position the patient in a semi-Fowler's position to promote lung expansion when the patient is dyspneic. So if the patient is dyspneic, administer oxygen 4 to 6 liters per minute in an adult. As soon as the patient recovers, make sure that the patient adopts any position of their choice to promote comfort. And also make sure that you are able to turn the patient every 2 hours to prevent the formation of pressure sores. Okay, so apart from position and ventilation, well, we can look at the rest and activity. So when it comes to rest and activity, in the acute stage, the patient should be on complete bed rest to prevent increased demand for oxygen. As the condition improves, the patient can do mild exercises. Okay, so apart from rest and activity, you also need to do observations. Under the observations, make sure that you monitor the vital signs. So under vital signs, you are monitoring for temperature, the pulse, the respirations, as well as the blood pressure 2 to 4 hourly. Then high temperature may denote infection, and when you check for respirations, you are trying to monitor if there is any dyspnea. Then also check for any signs of cyanosis to determine the severity of the attack, and also monitor the response to treatment. Check for restlessness, which may be as a result of dyspnea due to the obstruction. Therefore, administer oxygen. Not only that, you need to observe the patient's general condition. Okay, so even the levels of sweating, you need to check. So if there's profuse sweating in the patient, that you need to monitor as well. Okay, so apart from the observations, you also need to do psychological care. So on psychological care, make sure that you explain the disease process to the patient in order to raise knowledge levels and also to allay anxiety. You also need to encourage the patient to ask questions and make sure that you answer them truthfully according to what the patient has answered, and those things that you can not answer, make sure that you refer the patient to the physician. And also make sure that you explain the procedure to the patient in order to allay anxiety. Not only that, provide diversional therapy in order to shift the patient's mind from the hospital routines and the conditions. Not only that, make sure that you also involve the patient in the planning of the care so that the patient doesn't feel left out. You can also involve their um, relatives so that you allow them to provide emotional support to the patient. Okay, so apart from the psychological care, you also need to look at the hygiene of the patient. So you need to change the soiled linen to promote comfort and also wipe off the patient of the sweat which is there, ensure that the patient is nursed in a clean environment, and also as the condition improves, give a bath to the patient so that uh, that improves blood circulation as well as comfort of the patient. You also need to assist with oral toilet to refreshen the mouth and also to prevent infections. Okay. Now, if the patient is confined to the bed, you can do a bed bath. Okay, so on elimination, you need to provide urinal or bedpan when need arises to promote rest and reduce the demand for oxygen by the tissues. Also, make sure that you provide a lot of fluids and roughage to prevent constipation. And also, you can provide copious fluids to promote renal washout, therefore preventing renal problems. So when it comes to nutrition, provide small frequent nutritious meals, and the meals that it should be the meals that the patient likes. Avoid the foods that are likely to cause an asthmatic attack. So you need to check from the list of the allergies that has been provided and make sure that you avoid the spiced foods. Now, when the patient is not able to eat, provide nutrition through intravenous. Okay. Now, you also need to do regular mouthwash to promote appetite and also allow the visitors to bring food preferred by the patient to promote appetite. Not only that, you need to provide energy-giving foods to the patient in order to provide the energy needed for the metabolic processes. Okay. Now, you also need to give information, education, and communication to the patient, which is known as the IEC. So you need to advise the patient to avoid exposure to environmental pollutants such as fumes, dust, chemicals, and so on. That can predispose the patient to an asthmatic attack. You also need to advise the patient to seek treatment for upper respiratory tract infections early to prevent recurrence of the condition. You need to encourage intake of warm fluids as cold fluids can cause an attack. Also, encourage the patient to keep warm in winter to prevent uh, exacerbation of the condition. You also need to advise the patient to avoid overcrowded places where the patient is at risk of upper respiratory tract infections, which can lead to irritation of the bronchi. So, the complications of asthma includes status asthmaticus, atelectasis, emphysema, bronchiectasis, and death. Let's look at status asthmaticus. So status asthmaticus, this is a severe asthma that does not respond to conventional therapy and lasts more than 24 hours, resulting from the bronchoconstriction in response to a wide variety of stimuli characterized by wheezing, chest tightness, loss of consciousness. Now, the factors that contribute to status asthmaticus includes infection, anxiety, nebulizer abuse, dehydration, hypersensitivity reaction to aspirin, and also non-specific irritants. So the pathophysiology of status asthmaticus is that in status asthmaticus, there are a combination of factors that includes bronchial smooth muscle constriction, swelling of the bronchial mucosa, and thickened secretions which are persistent and contribute to the bronchial obstruction. There is ventilation perfusion abnormality that results in hypoxemia and respiratory acidosis. So the partial pressures of oxygen is reduced while that of carbon dioxide is increased. Meanwhile, the pH falls, leading to respiratory acidosis. So the clinical manifestations includes labored breathing, dyspnea, wheezing, okay, and so many others. However, with greater airway obstruction, wheezing may disappear as a sign of respiratory failure. So, with greater airway obstruction, eventually wheezing may disappear, which is a sign of respiratory failure. Now, let's look at the management, diagnosis, and investigation of status asthmaticus. Okay, so now, under the management of status asthmaticus, let's look at the diagnosis and investigation. So when it comes to the diagnosis and investigation, there is history of the patient being in severe asthmatic attack for more than 24 hours. And then the investigation, you notice that the atrial gas analysis is going to review a low partial pressure of oxygen, a high partial pressure of carbon dioxide, and a low pH showing respiratory acidosis. Then you need to manage the airway. So when it comes to the airway, the patient should be nursed in an upright position supported by the pillow on the cardiac table. Then you need to check for any presence of secretions in the mouth. Use a suction machine to clear the airway, and also loosen all tight clothing to maintain patent airway. You also need to administer short-acting medications like salbutamol to relax the smooth muscles, and also open up the windows to promote adequate ventilation. Not only that, you need to administer prescribed oxygen to maintain tissue perfusion. Then when it comes to the breathing and circulation support, you need to check for the respiration by counting the rising and falling of the chest. Then you need to observe for the breathing patterns of the patient to rule out dyspnea. Also monitor the breathing sounds of the patient, such as wheezing, which may be a sign of airway occlusion. Then massage the chest to stimulate cardiopulmonary activities, thereby maintaining the patent airway. Then on circulation part, make sure that you cannulate the patient using two large bore cannulas for fluid and drug administration. Then give prescribed fluids like normal saline to hydrate the patient. Then collect blood for grouping and cross-match. You also need to elevate the foot end of the bed to promote blood supply to other vital organs. Keep the patient warm to prevent hypothermia, and also monitor the vital signs such as blood pressure, temperature, and respirations, which will act as a baseline data. You can also give dextrose 5% to prevent uh, hypoglycemia. So now, under circulation, usually we give, in severe cases, we give 3 liters of fluids through IV. Okay, so 1 liter of normal saline is given, and then 2 liters of dextrose 5% is also given. Okay, and then on drug treatment, You can give salbutamol 4 milligrams through a nebulizer, or you can give aminophylline 250 milligrams IV slowly over 20 minutes. You can also give hydrocortisone 100 milligrams twice daily to suppress the release of histamine by the smooth muscle cells. Okay. Also, the beta-adrenergic antagonists such as albuterol are given to patients in emergency settings. Corticosteroids such as hydrocortisone injection can also be given to counteract the inflammation. Oxygen administration, 4 to 6 liters per minute, can also be given. And if the levels of oxygen partial pressures in the arterial blood is worsening, mechanical ventilation may be necessary. IV fluids can also be given for rehydration. So for the nursing care, which is a specific nursing care, you need to nurse the patient in an environment free from respiratory irritants such as pollen from flowers, cigarette smoke, perfumes or odors from chemicals or fumes. You also need to position the patient in the semi-Fowler's position to promote lung expansion. You need to nurse the patient in a quiet environment to promote rest. You also need to monitor the patient constantly, that is hourly, 2-hourly, or 4-hourly. So the first 12 to 24 hours or until the status asthmaticus is halted, check the vital signs, temperature, pulse, respirations, and BP. Okay. You also need to check the skin for cyanosis. Also assess the patient's skin turgor for signs of dehydration. Fluid intake is essential to combat dehydration and also to loosen secretions and to facilitate expectoration. So this is what I had for you. This is not everything on asthma, but this is what I had for you. So if you enjoyed this session, like the video, comment, leave your comment in the comment section, share the video, and see you in the next session.